Hey everyone, Dr. Mike here, and welcome to the channel. Today, we're tackling a topic that's crucial for your overall health and well-being, your gut. You've probably heard it called your second brain, and for good reason. The gut plays a vital role in digestion, nutrient absorption, and even immune function. But when things go wrong in your gut, it can impact your entire body. We're talking about a range of issues, from bloating and discomfort to more serious conditions. In this special series, we're diving deep into 20 common gut health diseases. We'll break down the causes behind these conditions, explore the telltale signs and symptoms, and discuss the treatments available. And because I believe in a holistic approach to health, we'll also explore natural remedies and lifestyle changes that can make a real difference. So whether you're experiencing gut issues or just want to be proactive about your health, this series is for you. Make sure you're subscribed and hit that notification bell so you don't miss an episode. Let's get started. Let's talk about irritable bowel syndrome, or IBS. IBS affects millions and makes life uncomfortable. Symptoms include cramping, pain, bloating, gas, diarrhea, and constipation. The cause is unclear, but muscle contractions and nerve issues play a role. IBS is manageable with medication and lifestyle changes. Diet and stress management are crucial. Take care of your gut and find what works for you. Now let's move on to a more serious condition, Crohn's disease. Crohn's disease is a chronic inflammatory bowel disease affecting the digestive tract. It can affect any part of the digestive tract, most commonly the small intestine. Thought to be an autoimmune disorder, the immune system attacks healthy cells. Genetics and environmental factors might also play a role. Symptoms include diarrhea, abdominal pain, blood in stool, weight loss, and fatigue. Treatment involves medication and lifestyle changes. Dietary changes are crucial to manage symptoms. With proper management, individuals can live full lives. Ulcerative colitis is an inflammatory bowel disease targeting the colon, causing inflammation and ulcers. Its exact cause is unknown but involves genetics, immune system issues, and environmental triggers. Symptoms include persistent diarrhea, abdominal pain, and weight loss. Treatments help manage symptoms and control flare-ups. Let's talk about celiac disease, an autoimmune disorder triggered by gluten. Gluten is a protein found in wheat, barley, and rye. For those with celiac disease, gluten triggers an immune response, damaging the small intestine. This damage affects nutrient absorption, causing various health issues. Symptoms can mimic other digestive issues, making diagnosis tricky. Symptoms include digestive issues, fatigue, anemia, and skin rashes. Managing celiac disease requires a strict gluten-free diet. Even tiny amounts of gluten can trigger a reaction. With dedication, living gluten-free is doable. Alright, moving on to a condition that affects millions of people. GERD, or gastroesophageal reflux disease. Ever experience that burning sensation in your chest after a meal? That's heartburn, a classic symptom of GERD. GERD happens when stomach acid flows back up into the esophagus, that tube connecting your mouth to your stomach. This backflow of acid irritates the lining of the esophagus, causing that uncomfortable burning sensation we call heartburn. Now, occasional heartburn is pretty common, but if you're experiencing it frequently, like a couple of times a week or more, it's worth getting checked out by a doctor. Chronic GERD can lead to some complications down the line, like inflammation of the esophagus, difficulty swallowing, and even an increased risk of esophageal cancer. The good news is that GERD is often very manageable with lifestyle modifications and medications. Simple changes like eating smaller meals, avoiding trigger foods, and not lying down right after eating can make a big difference. And of course, there are medications that can help neutralize stomach acid and reduce those uncomfortable symptoms. Let's talk about diverticulitis. Small pouches called diverticula form in your colon. Most people won't know they have them. That's diverticulosis. When inflamed, it's diverticulitis. Causes: low-fiber diet. Symptoms include abdominal pain, fever, nausea. Treatment: antibiotics, liquid diet, sometimes surgery. Prevention: high-fiber diet, exercise, hydration. Let's break down lactose intolerance. It affects millions worldwide. Your body struggles to digest lactose in dairy due to low lactase enzyme levels. Symptoms include bloating, gas, and cramps. Severity varies per person. Some tolerate small amounts, others can't. It's manageable and usually harmless. Avoiding dairy is one solution. Try lactose-free alternatives, or take enzyme supplements. Consult your doctor for testing. Discuss management options. Dairy-free can be delicious. Enjoy nutritious alternatives. Let's dive into SIBO, short for small intestinal bacterial overgrowth. It's when excess bacteria inhabit your small intestine, causing digestive issues. Symptoms include bloating, gas, diarrhea, and abdominal pain. Diagnosis often involves a breath test. Treatment includes antibiotics and lifestyle changes. Alright, moving on to condition number 9 on our gut health journey: gallstones. Gallstones form in your gallbladder, storing bile to digest fats. Thick bile can crystallize into stones. They vary in size from tiny grains to golf balls. Common symptoms include intense pain, nausea, and indigestion. Treatment ranges from lifestyle changes to surgery. You can live a healthy life without a gallbladder. Peptic ulcers are sores in your stomach lining or duodenum. Stress and spicy food can irritate, but the main cause is often H. pylori bacteria. Symptoms include burning stomach pain, bloating, and nausea. Treatment involves medications to reduce acid and kill bacteria. Lifestyle changes can help prevent recurrence. Next up, we're tackling gastroparesis, a condition that affects how your stomach empties. In simple terms, it's like your stomach's get up and go got up and went. Normally, your stomach muscles contract to move food along your digestive tract, but with gastroparesis, those contractions slow down or don't work properly. This delay in stomach emptying can lead to a whole host of uncomfortable symptoms. Think nausea, vomiting, feeling full quickly after eating, bloating, and even weight loss. It's like your stomach is saying, "Hold on, I need a break," while your brain is wondering why it's not getting the memo that you've eaten. Now, the causes of gastroparesis can be a bit of a mystery, but it's often linked to conditions that damage the nerves controlling your stomach muscles, like diabetes. Other culprits include viral infections, certain medications, and even surgery. Treating gastroparesis involves addressing the underlying cause and managing symptoms. Your doctor might recommend dietary changes like eating smaller, more frequent meals and medications to help stimulate stomach emptying. In some cases, a feeding tube might be necessary to ensure you're getting proper nutrition. Today we're tackling inflammatory bowel disease, or IBD. It's a group of disorders causing chronic inflammation in your digestive tract. Crohn's disease and ulcerative colitis are the main types. Symptoms include pain, diarrhea, and weight loss. It's a chronic condition needing long-term management. If you have symptoms, see your doctor for a diagnosis. Early detection and treatment are key. Let's talk about gluten sensitivity, a topic that's generated a lot of buzz lately. Unlike celiac disease, gluten sensitivity doesn't damage the small intestine but can cause discomfort. Symptoms include bloating, gas, diarrhea, and abdominal pain after consuming gluten. If confirmed, a gluten-free diet is often the best course of action. Alright, let's dive into pancreatitis, a condition that affects the pancreas, a vital organ responsible for digestion. This happens when the pancreas becomes inflamed, and trust me, you don't want to mess with an inflamed pancreas. Pancreatitis can manifest in two ways: acute and chronic. Acute pancreatitis comes on suddenly and is often caused by gallstones or excessive alcohol consumption. Chronic pancreatitis, on the other hand, develops gradually over time and is typically linked to long-term alcohol abuse or genetic factors. Now let's talk symptoms. Pancreatitis often rears its ugly head with intense upper abdominal pain that can radiate to your back. You might also experience nausea, vomiting, fever, and a rapid heart rate. These symptoms warrant immediate medical attention, folks. Treatment for pancreatitis usually involves a hospital stay to give your pancreas a chance to rest and recover. This might involve fasting, intravenous fluids, and pain management. In some cases, surgery might be necessary to address complications like gallstones or pancreatic damage. Remember, early diagnosis and treatment are crucial for improving outcomes and preventing long-term complications. Alright guys, let's talk about colon polyps. Colon polyps are small clumps of cells in the colon lining. Most are harmless, but some can become cancerous. Early detection is crucial. Age is a big factor. The older you get, the higher your risk. Other risks include family history, smoking, obesity, and certain conditions. Regular screenings are vital, especially if you're over 50. During a colonoscopy, doctors can remove polyps. Early detection is key to preventing colon cancer. Talk to your doctor about screenings and reducing your risk. Let's talk about a condition that's, well, a pain in the behind, literally. We're talking about hemorrhoids, those swollen veins in and around your rectum and anus. They're incredibly common, and while they can be super uncomfortable, they're usually not serious. So, what causes these pesky things? Straining during bowel movements, chronic constipation or diarrhea, pregnancy, and even sitting for long periods can all contribute. Basically, anything that puts pressure on those veins down there. Now for the symptoms. You might experience itching, discomfort, pain, especially during bowel movements and even bleeding. Not fun, right? The good news is that most hemorrhoids can be treated with simple lifestyle changes and over-the-counter remedies. Eating a high-fiber diet, drinking plenty of water, and exercising regularly can help prevent constipation and straining. Over-the-counter creams and ointments can provide relief from itching and discomfort. And of course, if you're experiencing persistent or severe symptoms, don't hesitate to see your doctor. Let's talk about another uncomfortable topic, anal fissures. These are small tears in the lining of the anus, and let me tell you, they can be pretty painful. The most common cause of anal fissures is, you guessed it, passing hard stools. Straining during bowel movements can create those tiny tears, and trust me, you'll know it when it happens. Other causes include diarrhea, inflammatory bowel disease, and even childbirth. The hallmark symptom of an anal fissure is a sharp, tearing pain during and after bowel movements. You might also notice some bright red blood on your toilet paper or in the toilet bowl. It's not a pretty sight, but the good news is that most anal fissures heal on their own within a few weeks. In the meantime, you can ease the pain and promote healing with warm baths, over-the-counter pain relievers, and topical creams. And of course, preventing constipation is key. So make sure you're drinking plenty of water, eating a high-fiber diet, and getting regular exercise. Let's talk about appendicitis, a condition that can quickly become a serious medical emergency. The appendix is a small pouch connected to your large intestine. When inflamed, it can cause severe pain and other symptoms. Pain usually starts around the belly button and moves to the lower right abdomen. If you suspect appendicitis, head to the ER immediately. It's usually treatable with surgery. Early detection is key. We've talked about a lot of different gut conditions, and now it's time to tackle a common yet often misunderstood one, candidiasis. Now, candida is a type of yeast that naturally lives in your gut. In small amounts, it's harmless and even beneficial. However, when candida overgrows, it can lead to an infection known as candidiasis. This can happen for various reasons, like taking antibiotics, having a weakened immune system, or even having a diet high in sugar, which candida loves to feed on. Symptoms of candidiasis can vary, but often include digestive issues like bloating, gas, and diarrhea. You might also experience oral thrush, which appears as white patches in your mouth, or vaginal yeast infections. The good news is that candidiasis is treatable. Your doctor might prescribe antifungal medications to control the overgrowth. Additionally, lifestyle changes like reducing sugar intake, eating probiotics, and managing stress can go a long way in preventing future infections. Remember, a healthy gut keeps candida in check. Let's talk about something we've all probably experienced at some point: food poisoning. It's not a fun topic, but it's important to understand. Food poisoning happens when you consume food or drinks contaminated with bacteria, viruses, or parasites. These harmful microbes can wreak havoc on your digestive system, leading to symptoms like nausea, vomiting, diarrhea, stomach cramps, and fever. The severity of food poisoning can range from mild discomfort to severe illness, depending on the type of contaminant and the amount you've ingested. Most cases of food poisoning are preventable. Always practice good food safety habits like washing your hands thoroughly, cooking food to the right temperature, and storing food properly. If you suspect you have food poisoning, staying hydrated is crucial. Electrolyte drinks can help replace lost fluids and minerals. Most cases resolve on their own, but if your symptoms are severe or persistent, it's essential to seek medical attention. And that wraps up our journey through 20 gut health diseases. We've covered a lot of ground, from common conditions like IBS to more serious ones like Crohn's disease. Remember, knowledge is power when it comes to your health. Understanding these conditions, their symptoms, and potential treatments can help you take control of your gut health. If you're experiencing any digestive issues, don't hesitate to reach out to a healthcare professional for proper diagnosis and treatment. Thanks for joining me on this gut-wrenching adventure. Don't forget to like this video, subscribe to my channel for more health tips, and hit that notification bell so you never miss an upload. Stay healthy and take care of your gut. It's the only one you've got.